My name is Deborah Coe. I'm on the Utah Suicide Prevention Coalition and on 3 of the coalition subcommittees. I also head one of those subcommittees. Suicide prevention is an important topic that affects all of us and is something we can all help with. Elder Renlund had this to say. I want to repeat this quote from Elder Renlund. What we need to do as a church is to reach out in love and caring for those who have suicidal thought, who feel marginalized in any way. We need to reach out with love and understanding. This is one of the most important ways we can help to reduce suicide. The group at greatest risk are those that identify as LGBT, that's lesbian, gay, bisexual, and transgender. In January of this year, Governor Herbert formed a special task force to address this serious suicide problem in our state. Lieutenant Governor Spencer Koch shared some grim statistics at that press conference. He said 5 out of every 30 kids in a classroom have suicidal thoughts, and about half of Utah's LGBT youth contemplate going through with suicide. Utah's youth suicides have more than doubled over the last 10 years. This is a graph of all the suicides in Utah over the last 10 years that we have data for. The number of suicides continues to climb at about twice the rate of the rest of the nation. Our youth suicides are even worse. After the Twin Towers were hit on 9/11, many people jumped to their death and died by suicide. These people weren't mentally ill. While there was often some kind of underlying mental illness with suicide, that is not always true. What is true is that people who die by suicide are trying to stop pain. That pain can be physical, like the people in the Twin Towers who realized it was less painful to jump than to burn to death, or it can be emotional pain. Dr. Thomas E. Joyner is one of the leading experts in the U.S. on suicide prevention. His research indicates that the 2 main elements that contribute to a person wanting to die by suicide come from a low sense of belonging or social alienation, and a perception that they are a burden. That doesn't mean that they're a burden, it just means that that's their perception. Suicide rates in response to the assassination of President John F. Kennedy were investigated. In the 29 U.S. cities included in the report, no suicides were reported during November 22nd to November 30th in 1963, following that assassination. It's interesting that we have the lowest number of suicides during times we pull together. Although detailed suicide rates are not readily available for the period following the terrorist attacks of September 11, 2001, we do know that calls to the 1-800-Suicide line, a national toll-free suicide crisis hotline, plummeted from an average of around 600 calls per day to around 300 calls per day, an all-time low in the days following the attack. This is something we can do differently, is pull together during good times as well as bad, and recognize that this has saving power when we connect with each other, when we belong to each other, and we don't focus on the differences as much as we focus on our common humanity. It's important to understand that what triggers a suicide isn't necessarily connected with the underlying cause. These are 4 places that we can all make the most difference: in the family, in the school, our faith communities, and neighborhoods. The church put out an excellent video recently with Sister McConkie, and she had excellent advice on how we can work together, particularly on these 4 places: family, school, faith community, and neighborhood.
Together, we have the ability to
According to Brené Brown, we believe that the most terrifying and destructive feeling that a person can experience is psychological isolation. In other words, not being connected with other people, not feeling like you belong. And that's different than just fitting in. Fitting in is conforming to be exactly like everybody else. Belonging is being loved for who you are and being loved despite imperfections, and realize that we're all working together to improve. Social isolation is not the same as being alone. This is an important point. It is a feeling that one is locked out of the possibility of human connection and of being powerless to change the situation. According to Brené Brown, people will do almost anything to escape this combination of condemned isolation and powerlessness. What results from a lot of that feeling isolated is shame. Shame has a negative effect and can run the gamut from numbing, people doing things to numb, to addiction, depression, self-injury, eating disorders, bullying, violence, and of course, our topic for this class, suicide. So a lot of times we kind of say, it's just me. What can I do? I used to think this as well. I didn't think that there was much I could do to make any difference. I believe now that we can all make a difference. It goes with something President Uchtdorf said. We could cover the earth with members of the church, put a meeting house on every corner, dot the land with temples, fill the earth with copies of the Book of Mormon, send missionaries to every country, say millions of prayers. But if we neglect to grasp the core of the gospel message and fail to help those who suffer or turn away those who mourn, and if we do not remember to be charitable, we are as waste, which refiners do cast out. Without this transformation work of caring for our fellow man, unless we care for one another temporally as well as spiritually, we cannot please God, and it is impossible to become a people of Zion. In other words, we need to pull together. We need to help everyone feel that they belong. We need to do what Elder Renlund said and watch for those that are being marginalized and see how we can lift and help. This is one of the prime examples of Christ's life and the example he set. Elder Renlund gives us some really good advice on where to start when you're with someone who you recognize is suicidal.
It's completely sad.
So one of the first things we need to know how to do is to watch and listen for warning signs. Unfortunately, we don't have time in this class to really teach that. There's a training called QPR, Question, Persuade, Refer. It's a training that all adults should take. It helps explain exactly what to watch and listen for so that you recognize when there are warning signs. Just very briefly, there are direct verbal signs where someone will say something directly like, I want to die. There's indirect signs where maybe they'll just talk about being tired of it all. They'll talk about not being there when you get back. There's behavioral signs, like they might start giving away their very prized possessions that they wouldn't ordinarily part with. And there are situational clues. Perhaps they've just been diagnosed with a very terminal illness that's extremely painful. Or perhaps it's a young person and they just lost a parent. Again, I strongly recommend taking QPR training where they go into detail of what to watch for. It's made for everybody, not necessarily any professionals, just parents and neighbors. The problem is that when most people display a warning sign and say something that should clue us in, this is how most people react. We basically don't know what to do. We might say, I've got to go now, or we'll change the subject, but we don't address the problem and the person feels that much more isolated. It's very important to understand that they are feeling like a burden to society and they're feeling like they don't connect to other people. They feel like they don't belong. And when we react this way, we're only increasing and intensifying that feeling for them. When we remain silent and don't ask the question, like Elder Renlund said, of asking if they've thought of harming themselves or however we want to word it, we are being silent, and that still equals suicide. When we see people being marginalized, which is causing them to feel like they don't belong or dehumanized, we are also not stopping suicide. That silence is deafening sometimes, and it's so important that we all learn to speak out and learn to defend people and learn to ask when we see somebody has a need. It's important for us to realize that if we don't do something, who will? We have many trained professionals in this country, but identifying the person who might be suicidal is difficult because many of them don't get or seek professional help. It's important that all of us be aware of the people around us and be aware of what to watch for and how to help others. After you ask the question, in whatever form you choose, if they are thinking of harming themselves or if they've thought of suicide, it is important that we just listen and listen and listen, not talk. Most of the time they want to talk. Most of the time they want to share this burden with somebody. They want to not feel alone. People actually need that connection and feel like someone is caring. Talking helps them find a way to live. It gives them hope. Once we reach that point, where we've talked and we've listened, it is important to know where to get help and how to help them seek someone that can help them in the long term and knows how to professionally assist them beyond what, of course, any of our capabilities are. So it's important to have a list of resources where you know how to access them. Again, this goes with being trained, and I strongly recommend any of the various trainings for parents and neighbors and all adults, whether it's first aid, mental health, Safe Talk, QPR, or any of the other excellent ones already prepared. All of us need to seek that training. In closing, I want us to remember, unexpected kindness is the most powerful, least costly, and most underrated agent of human change. Thank you.